Mhm.
Yes.
So I'm saying that in any case, if I feel that we need to repeat, then I give millisimal. And in some cases where genetics is involved, heredity is involved, I give centesimal potency, single dose or infrequent dose. This is my
Okay.
approach. And one more thing is, in any case, if where I'm not sure about the medicine or say medicinal diagnosis, I give millisimal only. So that by repetition, the repeated this shocks or repeated um, what do you say repeated strike, if doesn't help, then doesn't cause any aggravation. Any tumor, I give high potency single dose. If there are functional disorders, sometimes in malignancy also, centesimal potency, but repeated doses. In coma cases, we give single medicine, single dose, or maybe repeated once a day only, or once in 2 3 days.
Why in coma cases, like one single dose?
Because body takes time to react. We just stimulate the vital principle, and that
Mhm.
takes little time to give its effects to the body and mind. That's why infrequent repetition.
Right.
Sanjay,
Why
please.
in tumors the higher potency?
Tumor, see, tumor, if you go with the pathophysiology of any tumor, you'll find there are 7 changes happens in genetics. There are 4 genetical changes in mutation. Before 4 changes, things remains benign. After 4, it becomes malignant. 4 genetical changes. I don't know the names of all those steps, but there are 4 and 7. 7 is the highest, where malignancy cannot be reverted. I
Reverse.
haven't seen. I haven't seen such case, but up to 4, I have seen many cases reversal of many cases. Up to 7, we can give very good palliation. We give good ease and comfort to the patient. This is up till experience up till now. Maybe in future we don't know what
But
experience
in
comes.
tumor, you said ki high potency. Why you give high
Single dose.
potency?
No,
Why?
see, there are changes. But see, the cell, this mitosis and meiosis divisions, when the growth starts, the break to the towards the growth, that is gene 52 or something, that is partially active. To stop that and revert that, we need a single stimulation only. If you repeat, that may get confused. Or
And
if
in
you repeat in
Mhm.
higher power,
Okay. And in cases of diabetes and thyroid, all this kind of
millisimal,
thing,
diabetes millisimal, because we need
and
repeated hammers. In hypothyroidism, mostly single dose or weekly or fortnightly.
Mhm. Okay.
This
Why,
is
sir?
my
Because
way.
it is functional. Because it is functional change.
Uh, it is more functional. Pathology hasn't advanced much. I have a case of Hashimoto thyroiditis with multiple nodules. Today I had the follow-up of that. To that girl, or let me say to that female, I gave Staphylococcus 2 months before. And out of 4 or 5 nodules, 3 disappeared. Swelling has reduced. Even her thyroglobulin, anti-thyroglobulin antibodies reduced to 300 to 70 or 26 or something. And anti-TPO is the same. Anti-TPO will reduce now. So in that case, single dose mostly. We need to go toward behind the pathology. What could be the reason? And generally, I understand pathology or say organ, any organ. It is what is the function of that organ? Thyroid, just for example, thyroid is the center for metabolism, right? It is also center for calcium metabolism, parathyroid. At emotional level, thyroid is the center for communication. Communication is of two types. It is verbal and non-verbal communications. And the spiritual function of the thyroid is one can develop the magnetism in the voice. So I consider all these three, what has happened to the patient, and then accordingly analyze and give the medicine. I'm sorry, Sanjay, I have
No,
taken,
no, no,
I'm
no,
taking
no.
a lot of time. Mm.
You are not taking any time. You are on the
Uh-huh.
topic. So
Yeah, no,
this was
that
the
is so
topic.
true about thyroid disorders
Mm.
and the center of communication and things like that. When I had a follow-up recently with somebody with a thyroid problem, she was talking and I asking her, how do you feel about that? And she's like, I try not to talk about it. And I'm like, well, that's part of the problem that you need to be able to express, because the expression is you need to be able to release that, because that is the
Absolutely right.
area.
The
Mhm,
case about what I was talking,
Exactly.
Hashimoto thyroiditis with multiple nodules. That
mhm,
that female is a married female, and she was not allowed to speak at in-laws' house. And if at all she tried, sometimes she was beaten up by in-laws, and husband was also not supportive. So she had lot of pent of anger with silence.
mhm.
Yes, it
Uh,
happens. Actually,
mm,
in Indian females, there is lot of thyroid
don't say
problem
Indian
is a
females, it
leading.
is, don't say about
Yes,
Indian females, it is with every female around the world.
yes,
More or less, we
yes,
are same type of human.
yes,
There may
yes.
be a little
Actually,
difference, some
yes.
percentage difference. Otherwise, it is everywhere.
We use the book Heal Your Body to
Mm,
convey that you should express.
mhm,
That is very nice book, and in that reason
mhm.
for everything is given. It's very nice.
I suggest one thing.
Mm.
That is, um, the name of that book is um Psychic Reasons Behind Every Pathology. It is
Yes,
Danny
in Heal
Carroll.
Your Body also it is same. For every
Mm.
disease, it is
No,
written the what is the cause.
no, I differ.
Who's the author of that book?
Danny Carroll.
Can you put that in
Danny
the
Carroll.
chat?
Pardon?
Can you write it in the chat?
Yeah, yeah. I'll share in the group his book, his ebook. I'll share,
Okay.
and he has explained so many things as per organs emotions, and
Yes, even
he himself has healed many of his issues. He describes he was having multiple myoneurolipofibromas. You understand this? Multiple myoneurolipofibromas. There are four conflicts. Muscular conflict is different, fat conflict is different, nerve tissue conflict is different, and muscle
Mhm.
conflict is different. So he was having multiple all around the body. He tried to understand what has happened, what has happened, what has happened. And ultimately, one day, he understood what has happened to his life. and you will wonder, is all this myoneurolepofibromas disappeared overnight?
So
No
is this
medicine.
kind of like conceptually kind of like German new medicine?
Yeah, yeah,
Mhm.
yeah. He is following German new medicine of Dr. Rick Grid Hammer.
Uh-huh.
So I read that, I understand that Dr. Hammer has gone to just at cellular level, not at
Mhm.
genetic and on deeper emotional level.
Right.
We are, me and my group, we are working beyond that, beyond cellular level. We have given our topic is mind of pathology, not the pathology of mind, but we have given mind of pathology. So some of my friends or our group, we are working on it
Mhm.
for every disease. Like in last 6 7 years, we have had a seminar on ophthalmological disorders, ECG plus anginal disorders, thyroid disorders, diabetes, renal disorders, and last we had on last month we had on PCOD plus uh, infertility, female infertility and male infertility.
Yes, you posted your
Yeah,
brief for that. Mhm.
I asked you, can I share
Yes.
this in group?
Did anybody come?
No, no, no. But
No.
we had, but we had, we had participants from uh, around 12 or 13 states of India, and 2% came from Dubai.
Just share
So
me the link, sir. I'll also join.
next time we'll be having next on 24, 25th December.
Okay.
Is it going to be in English?
Yeah, yeah, it is. See, we have both type of people who can understand Hindi and English both. So we speak in both the languages, or we use sometimes Hindi, sometimes English. We are trying to have recordings of that from next time with English, uh, what we say,
Subtitle.
titles, English titles, so
Yeah.
that it can be understood well to other people of other tongue, other language.
Very good. Yes, let us know when the next one is.
24, 25 December, this is the tentative date. This will be in Jaipur. And before that, there may be one seminar may happen in Mumbai, nearby to suggest a place. It is Mumbai Kalyan. One of our team member is there, so he is trying to organize. He is trying to organize on infertility, starting with PCOD, female infertility and male infertility.
What is date at Mumbai?
Mumbai dates are yet to be finalized, but possibly after Diwali. Possibly. It was supposed to be held on 1st and 2nd October,
Mhm.
but because of some reasons, we couldn't. 24, 25th December is Sunday and Monday.
Three. Okay. Just let me know also.
Yeah, 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 sure.
Probably I could be there after 3 months in Mumbai.
Okay,
Means after Diwali.
that would be fine. It will be a pleasure.
If that coincidence happen,
Mm.
so I
If
can
at
be there.
all, if at all there is no coincidence, you plan it. I'll
Yeah,
phone you personally. I'll
yeah.
message definitely to all of you. If whoever can participate, whoever can come, will be happy.
It's at Kalyan.
In Mumbai, it will be in Kalyan.
Okay.
One of our team member is there. Already we had two seminars in Mumbai
Mhm.
in last 5 years, and one in Delhi one in Rohtak, 6, 7 seminars in Jaipur, and one in Dubai. In
Mhm.
last 6, 7 years, we are having such.
That's good.
So we have team. Our team's name is Learn Limitless Homeopathy with Mind of Pathology.
Mhm. No, that's a very important thing.
Mhm.
See, learn from everything. Everything will teach you.
Right.
But you need to enhance your own abilities to understand things.
True. True.
Unless, see, you can handle pathological cases very keenfully, right?
Mm-hmm.
And that's not everyone can do.
Mm-hmm.
Yes.
Huh? So, because sometimes I might not give same prescription with same repetition of dosage in the
Yeah. Yeah.
condition.
Yeah. Yeah. It
And
happens. It
because
happens.
my
Mm,
perspective to look at disease is different, you have very different.
mm,
And if you practicing your way, you can apply any learning or any teaching
mm-hmm.
in your ways. You can apply that, but I cannot apply your understanding in my practice.
Yeah, that happens.
Yeah. So
Once we
basically,
understand.
I
Mm,
teach every student or every homeopath.
mm,
You should learn from everything. Every one will teach you,
mm-hmm.
but don't follow anyone unless you
Follow
yourself.
homeopathy, or unless otherwise you are convinced, then.
Uh, but you should be what you call that curious to answer the questions or
Yeah.
ask questions.
Yeah. Yeah. That is true. That is true.
So Gunjan might be a great homeopath in couple of days or years.
Yes.
I don't know, sir, but yes, maybe.
No,
Be
because
positive.
people see you things what are important to be a homeopath is to have many questions
That's right.
and try
Mm,
to find answers to that question. And
and
from where you can have answers from books, from your friends, from your colleagues, from your teachers, and not
I
only
tried
home,
from everyone.
mhm.
yeah, and that will just polish ourselves.
Yes, sir.
That's
So
true.
we should enhance our own way to practice.
Right. That's right. And as Gunjan said, maybe here those who read and understands the this principle of attraction, they always use positive word. As he
Maybe.
said, maybe, no. Let's God give the same what you are saying. Let's hope so. Okay, okay.
Yeah.
Your words may become true.
Yes, thank you,
Yeah.
sir. Yes, I'll definitely
Because
try.
I have seen those who have a lot of questions, actually, they have that high intellect to understand things.
Mhm.
That's why. Uh, Can I share one a small case? Actually, it is not actually a small case, but I'll share in a shortest time. One
Mhm.
of my friend in Delhi, he had one case of a little child. Let's say not child, it's an infant. He was having VSD, and he
Mhm.
used to cry every now and then. And the moment he cries, his face and this neck portion becomes bluish.
Mhm.
This case is of around 10 or 12 years before. So he took the case and asked, he just called me, कि यार ऐसा ऐसा है, what to do? Tikva, you understand? ऐसा ऐसा है means the case is like that, then what to do? I said, this boy is just 2-3 months old and he is having VSD. VSD is not a big deal. So many child have, but why he is crying so and having bluish face and bluish chin and neck? He said, sir, I don't know. Ask the mother, take the pregnancy history. He has taken all that, but that was of not use. Gradually, from the history of mother, we learned that mother of that child was married to the person who was beloved of her mother. Can you understand this? The
No, I
baby's
missed out
mother,
that part. Who's the,
the baby's mother was married to a person who was beloved of her mother.
Acha. Means that guy was interested
Guy,
in mother and her
no,
daughter,
guy was beloved of mother-in-law.
both mother-in-law, right?
Mother-in-law, and this girl came to know about the affair of mother to this person. To hide that, mother got married her daughter to this boy.
huh, strange.
This is you can understand the conspiracy and the hide plan. And being the 10 or 15 years younger to that male, she was not allowed to speak a single word. She was not allowed to go out. She was not allowed to talk to anyone. She was not interested in lying with that male, having relationship, but she was forced to. Within a month or so, she became pregnant. And that mother, you will surprise when she came to my friend doctor. She was just 19 or 20 years old. She used to think, let me die, let me commit suicide. But since she was not allowed to do anything, not allowed, every person was having eye on her. So she was not allowed. We took and we just tried to understand that case. This baby is trying to commit suicide. And every now and then on truffles, he used to cry and got bluish face and neck and something. Surprisingly, we gave medicine or a mat, milisimal, and that boy improved in a week. He started improving. Not only he started improving, but her mother's mental status also started improving. And if I remember well, in in 1.5 year to 2 year, mother got separated from husband, and the boy, he's I don't know about the VSD, what happened, like, but his bluishness, everything was disappeared. How to understand the case? We need to go in the just behind the pathology. Why blue? Why this? Why VSD? Why that? VSD also in one of my understanding, VSD also develops out of non-union. Our body develops separately on right side and left side. They merge then.
Right.
Whenever there is a pathology in the central line, the pathology of central line, our first uh, medicine is syphilinum. In one of our group's book, this golden thread of homeopathic medicine, when I when I was writing that, so that book's author is my friend Dr. Dilip Soni, but the total book is this edited by me. So in syphilinum, I have given more than 25 rubrics where this non-union of central lines conflicts is there.
Mhm.
And the single medicine is syphilinum. Just it is a month around. A case of, it is not my case, it is one of my students' case. She had a patient of vitiligo. That was vitiligo on the scalp. And she gave medicine 1, 2, 3, 4, 5. That didn't help. Then the patient asked her, see ma'am, this is on center of my scalp. It is center of my scalp. She saw and she was knowing about the syphilinum. She gave just syphilinum 201 dose and total vitiligo disappeared in 1.5 or 2 months.
Hmm.
Huh? एक minute. Can you give me a little time? I have an important call. Please continue.
Yeah. Okay. Gunjan,
Yes, sir.
any other question?
No, not. Just how to judge when you give the LM potency, what are the reactions and how to judge it?
Basically, if you ask me, it is the same way. Centesimal scale and LM scale. Only scale difference is there. The potency wise, uh, these medicines are same. Strength wise. Even you have low potencies in LM, we have already talked about that. Mid
Yes, that
potencies
I know.
and even
But
higher
what
potencies.
reactions you expect? That was I was also.
So actually, I don't have that much experience to use LM in the pathological cases like that. Because my way of using LM probably is not same like Tikva or Jaswant is doing. Because what I told you previous time, unless and until you have very accurate simillimum, LM won't show you that results. Accuracy is very important because LM is higher dilution. That drug has been diluted in large quantity. And it's been potentized. So dynamically it is charged. But quantitatively it is higher dilution. So to have an effect, you need a multiple repetition. 1 or 2 dose won't help. And unless you have that accuracy in the symptoms, means it's LM won't work like blind shot. Wrong remedy, you don't get anything in it with LM. Means wrong remedy means you need to have that strong symptom in drug and you need to have that susceptible and sensitivity in the patient. Means what I mean to say, patient susceptibility is strong towards that symptom. That means this symptom should be a strong symptom of that person also. You cannot take a minor symptom of drug with a major symptom of person. For that, patient need to have a strong affinity towards that drug. Hello? Igwa?
Yeah, I'm here.
You can just pop in and correct me if I am wrong.
That's your experience. Your experience is that you need to feel that your prescription is correct before you'll start an LM potency. That's your experience.
Yeah,
You're just
that's
sharing
why
your
that's why
experience.
I begin with centesimal scale. And if I see that remedy is going very strongly with the person, then I can just directly jump with the potency and repeat as much as I want whenever the patient need. Right. So the it's not about how we are using the potency. It's about how, in what condition we are using which potency. And that actually we need to learn from our own experience. Probably just one might use very confidently LM potency in pathological cases.
Yeah, I'm using LM potency for last 35 years.
So
Yeah.
you've been using LM potency longer than I've
No,
been
no,
using
no.
LM potency.
LM means it's not about using LM potency, but it's using LM potency in pathological cases.
Yeah. See, when I
Ah,
was in NIH, Calcutta, so there people used to practice LM potency in pathological cases. So one of my
yeah.
teacher, he used to prescribe LM potencies in many of the cases. I was with him for more than 6 months in the clinic. So I learned from them. Gradually, still we are learning with every case. So LM potency I use here in where I live in Rajasthan. There are only few people who are using LM potency, and they all are my students. Then they started using LM potencies, and
I would
where
like to
in
ask you, sir. I would
you,
like to
Sanjay,
ask
please
you when. No, no, no. I really
just
want to
call me by
understand
name.
this. And so, I would like to ask you when you are using LM potency in pathological cases, like
Mhm.
deep pathological, any
Mm,
tumors or any like
mm.
that. So that time, how much means doses you repeat?
Generally, I give twice a day. 0, 1, 0, 3, 0, 1, 2, 3 twice a day. And
Uh-huh.
if higher than that, if 4 or 5 once a day, if or alternate day or twice a week.
Right.
I
Because
rarely,
LM,
I
LM,
rarely use LM more than twice a week because the clientele that I'm treating doesn't usually do well with a daily dose.
Mhm.
But I think that we have in a lot of ways, there's a lot less spicy food and different things
Mm,
like that. So my
mhm,
experience is that that would be for a lot of people, that would be too much dosing.
mhm. Here in India, everybody takes a lot of spices every day.
Mhm.
Spices, ginger,
we
and
are
this
we are
cardamom and
living in most contaminated environment. It's
And
not only a food.
everybody thinks it's the opposite. Everybody thinks you guys are living out there in the picture of health. You have no radiation. You have no pesticides. Everybody's like, oh, the pure and pristine people in India. And I'm like, what? They've got the same poison in their food.
Yeah,
They've
yeah,
got
yeah,
the
yeah.
same cell towers. They got the same stuff that everybody else does.
Mm.
It's just that you have some changes in things like diet and other things. But yeah, nothing stops the
No,
Indian person from getting the alcohol as well as anybody else. So
I take it this way that Indian people, they take all the spices and ginger and all these things for last so many centuries. They were using, so their probably their genetics is so that
Strong.
they digest very well, and sometimes it doesn't hamper our medicine. In some of the cases, those there are certain families they don't want to communicate to the patient that they are giving some medicine. There are many patients who are alcoholic. So family people, they don't want to inform them that they are giving some medicine to withdraw. So they give it even in alcohol, sometimes in tea, sometimes in coffee, sometimes in any vegetable which is spicy. And I have seen in 30% of the cases that that helps.
Mhm,
So probably all the spices, they are accustomed, body is
mhm.
accustomed. European and other people, they were not using spices centuries ago. They are using now. That too is very little.
Yeah,
So
there's a
their
lot
body.
more use of herbs than there are
Mhm,
of spices.
mhm. So that can here. That's why I prescribe this way.
But why would somebody not use LM in pathology? This is a new thought for me. Why would
No, no,
somebody
no. Means
hesitate?
you can use, but
But what would
problem is
hesitate?
that see, it's not about dynamization. Dynamization of the LM and dynamization of centesimal
Mm.
scale. It's same, but difference is about dilution. Centesimal scale is less diluted and LM is higher diluted, means more diluted. So what happens if the medicine is less diluted, you have a very strong medicine. And when it is more diluted, you have a little medicine, and when you are using that in the dynamic way, means in potentized way. See, you are using centesimal scale. Now you are using this. In centesimal scale, you have those potencies like lower potencies, mid potencies, and higher potencies. Similarly, we have that structure in the LM scale also, like LM1 to LM8, 9, it's considered as lower potencies. Like in centesimal, we have 12 to 30. We don't have actually 12 to 60, you can say, in centesimal scale. And mid potency in LM, we have only like 10, 11, 10, 11, 12. And about 12,
Sanjay, my view is a little different. I consider above LM5 are higher medicines.
no, it's
Sorry.
that's why I'm trying to explain these
Mm.
things.
Yeah,
About
I
12,
personally never
about 12,
used anything
about
other than
12.
LM1, LM2, and LM3, because if I start somebody on an LM1, they're going to be done with treatment by the time I'd get to an LM10. I mean, how much medicine is somebody going to need?
Because in centesimal scale we have 12, then we have 30, and then direct we jump towards 200. But LM, we are having 1, 2, 3, 4 like this to 30, or I don't know if anybody is having
Only up to 30 only.
right.
SBL and HEPCO manufactures up to 30 only.
So whenever you are considering a 30 potency in centesimal scale, 30, that goes similarly between 7 to 12 in LM. And above you can go
Sanjay,
about
please
12.
just wait, Sanjay, please.
Mhm.
Let's calculate mathematically. In LM1,
Laxmikanth has something to say.
sorry,
Laxmikanth has joined us and he keeps raising his hand. I think he has something to say. You have to
yes, please.
unmute yourself.
Uh-huh.
Yeah.
Good evening. Good evening. Good evening to you all. Sorry
Good
for my I lately
Good
joined.
evening.
uh, and many just now I heard about that we are talking about 0 bar 12 and 0 bar 15. In my 20 years of experience, many of cases, pathological cases I have treated with LM potencies, started with 0 bar 1. By the time I reach 0 bar 6, most of the cases has been cured. I never get a chance
Right.
to go for more than 0
Beyond.
bar 6 or 0 bar 7.
Mhm.
This is one experience.
And
Second
same
thing,
is mine. Same is mine. I haven't used more than LM7 in
correct,
last
correct.
40, last
Even I
35 years. I
also
haven't.
not gone above 6 or 7.
I've never
Yes,
even
yes.
gotten to 6 or 7.
And the results are amazing. Results are amazing. Second thing, why the topic is only in the pathological cases. LM can be used any of the cases, even
No.
incurable
It
cases.
can be used in any cases, sir. No problem.
Ah,
But lot of people don't use LM in pathological cases.
And I'm wondering why.
So I don't know why, but at Jaswant's is
just the
using. I was
lack of understanding or lack of a proper guidance for them. But we
probably.
use even in acute cases also, we use
Right.
L1, 0 bar 1 and all, and the amazing results we are getting. And third point, you are telling 0 bar 6 is more or less equal to 30 potency. I don't think so.
No.
I don't
It's
think so.
not. It's not the same one potency, sir. It's
Ah,
range between like 6 to 12. You can consider whole set.
No,
may
It's
Sanjay,
not
I
a,
be, sir.
disagree. Sanjay, I
It's more
disagree.
than
If you
that.
calculate
huh,
mathematically,
Correct. Correct.
LM1 is 1 raised to 50,000 only,
Correct.
right? And say 30 potency, it is 1 raised to minus 60. Matlab, after 1, you write 60 zero number. So in LM1, it is 50,000 only. In in 30th potency, it is trillion.
Correct.
no.
See,
You are just confusing between two, for dynamization and dilution.
no, I'm saying dilution only.
So dilution is just 1 by 99 and 1 by 50,000.
Okay, may I speak?
Haha.
Yeah, this is your specialty. The pharmacologist,
Yeah.
not
So,
pharmacology, the pharmacist.
no, yeah, a little bit is different in the procedure the making the medicine in the centesimal, decimal, and 50 millisimal. There is a ratio is a different. Like if we can making the medicine in the pound or in kg, it is a little bit different. So very big different is the we identify कि there is a centesimal decimal we only give the 10 is down stroke and the 50 millisimal we give that 100 down stroke. This is a very big difference for the developing the energy. Okay, is a ratio is a different like a decimal is a 1 is to 9 and the centesimal is a 1 is to 99, but 50 millisimal we start the with the first is a 1c, then second c, then 3c, then 3c in diluted into 500 drops, then it is called the totally 50,000. Means the 100 drops of the alcohol and 500 part of the medicine pills. Then it is called the 50,000. There is a very little bit, nobody understands the where is the 50,000 come. Because if you start the medicine, so first we start the dynamization of 1C. 1C when prepared, then after go for the 2C, then go to the 3C. After 3C, we start the 50 millisecond scale. Or every after 3C, we give the downstroke every time 100. But then the decimal and centesimal give only 10 downstroke. There is a downstroke, it is a very big important because the in the physicist, or it is a matter, because in the it is a matter part more in the 3C. When the we downstroke give, because the friction is come in the molecules, then that was the matter convert into energy. So easily we can convert into energy by the 100 downstroke. It's my opinion. I understood the by the because I am teaching the pharmacy, and mostly I is potentization, dynamization my favorite topic. So there is a one you have seen that this is a electromagnetic wave. We can develop the easily electromagnetic wave, the dynamization the 50 milliswell, and our procedure is based on the electromagnetic wave, not the matter. Before the 12C, we can mostly see the matter form, like a molecular form. We have two particles. One is the particle form, one is the electromagnetic wave. Same medium. Thank you so much.
And I have studied one case, one some website or somewhere. I could 1 minute. Am I audible to you all, sir?
Yeah.
Yes.
Only 1 minute. 1 minute. 1 minute. There is one. I saved one thing also. They have given one interesting scale. Here is the scale or the comparison how the potencies stand till CM and LM16. 30C, after that LM1, 200C, then LM2, LM3, then 1M, LM4, LM5, LM6, 7, and 10M. See, this is how they are calculated. I don't know whether it is right or not. I want to show this, but I don't know how to exhibit.
No, this is not right, because the according to
No.
calculation is that they given, but the very big difference is the Dr. Hanneman, they give the only downstroke is the different. Ratio is the difference is okay. Because
Can I
study
interfere
in the
in
decision
between?
is different.
Yes.
Yes, sir.
Yes.
Friends, can I interfere in between? I have an
Please,
emergency case, so I am leaving this meeting. Please excuse.
Okay. We'll meet again, sir.
Okay. Thank you, sir. It was very valuable.
Okay, bye.
Yes, madam. Yes. And madam, you tell me again what is this downstroke? I could not understand. Please elaborate.
Downstroke means give the medicine weight like this, no? Only if
Suction.
we take the yes, suction. After 3C, every medicine is dissolved in the alcohol. Before 3C, some medicine is dissolved in the alcohol, some dissolved in the water, and some like a potentization, like a trituration. But after 3C, every medicine is dissolved in the alcohol. So after in the decimal scale, give the 10 downstroke. When the Dr. Hanneman has started, he started the 2 downstroke in the organon of medicine is the 264 to 265 medicine. But when the gradually he improved the what's the reason behind the medicinal aggravation, so he changed the potency. He wants to change the more potency. So he started that 100 downstroke. When the centesimal is a 10 downstroke in the 5th edition. Before when the 5th edition you will study here, and the first 4 edition is mostly give the 2 downstroke. So downstroke, it is a more focus on the succussion. Why we are giving the downstroke? Why we are giving the like this? We can dilute. Dilute is what like a water, mix or alcohol, whatever we use. Like is the one part of the alcohol and the one part of the medicine and 9 part of the water. This is a dilution, not the potency. When you give the downstroke, then you start the potency.
That's what I was telling. Dilution is different thing, and potentization is different thing. Dynamization is different thing.
No, potentization and dynamization same thing. Is a synonym.
Yeah. That's I'm trying to say that dilution is just mixing extra water or extra
Extra
that
water,
liquid.
extra alcohol, you can meet
You can
anything.
So
When the some quantity is a sugar
medicine
of
part
milk
is only
also.
one, and you dilute in how much quantity of neutral vehicle, that is dilution. But potentization, you are just activating that molecules, whatever molecules are there in the fluid. So the number of strokes you are giving, that matters. That same
Yeah.
Dr. Sandhya told. So we homeopath need to understand dynamization is one thing, and dilution is another thing. So if you considering the see, if you look at the timeline, why Hahnemann wanted to change his own method, because centesimal scale was introduced by Hahnemann. Why he wanted to uh, change? What problem he has using the centesimal scale?
Every time only Dr. Hahnemann so much work on the pathology. When he was started in 1990, when he proved the medicine of the Parvien Barco Syncona, that is the mother tincture. After that, if you will see the Belladonna in the Materia Medica period, you have seen he dilated the dose, but he not started the potentization. Even the fourth edition, there was the no potentization. In the fifth edition, before he started the potentization, the chronic disease. First, he introduced the chronic disease. After that, in the fifth edition, he introduced the why he was because he know that there is so much aggravation. We need to just stimulate the medicine. Like in allopathy, they have a four part. One is the absorption, first stimulation, absorption, metabolism. So we cut off the everything. We just give the medicine. He work on the nerve. So nerve is just stimulate. So we need the small potency. That's why in the 275, you see the 275 or 270, so he wrote there is a magnitude, not the, what is meaning of the magnitude, means the frequency of we change to frequency of a medicine. Matter to non-matter, matter means when the medicine is the molecular form, this is the matter. When the molecular turn into waveform, that is a in the our medicine, we protein by the suction or by the downstroke, we develop the photon. Photon just is a two kind of the particle. One is a photon turn like a particle, and second is a like a wave. It is a one particle, whoever two identification. So this is a different scientific way. If you see the dynamization in the pharmacy, there is a letter E is equal to MC2. What is the matter of the MC2? What is the number of the Avogadro? 6.0223. So this is the important approach to scientific. Like we are talking about the boy because of the wave. It is not possible without the electromagnetic wave, and it's gone. So same things are our medicine. Why the molecule turn into electromagnetic wave? This is a suction method. You give the 100 downstroke, usually electromagnetic wave develop.
Right.
So the question is now, LM1 is beyond the 30C or 200 beyond it? What is the level?
No. See,
So there is
LM1, LM 200. If you look at the scale, 200 is you will see it is taking a same amount of dilution. In 200, or if you take LM potency and amount of water you are adding, look
if
at
you see,
LM1,
Sir, how
you are
you are
using just
uh,
50,000.
like me, sir?
Huh?
Yes.
How he is using, I don't know.
Oh,
Lakshmi sir, I'm correct?
Yes, yes, Lakshmi Kant. You
Yes.
want me
Lakshmikant.
to you want me to know you want to know how I am using 0 bar 1, right?
Right.
Yes.
Usually the methodology what I practice is I will take 30 ml of 1 ounce bottle with this diluted water, and I will add 1 or 2 drops of extra neutral alcohol in that, and a few pellets of selected medicine, few pillules, very very small poppy size, few, maybe 3 or 4 I may use,
Yeah.
and I will give 10 succussions. From that, I will ask the patient to pour 5 or 6 drops into 100 ml of water, thoroughly mix with a spoon, and take only 1 spoon of water, and the rest of the water to be thrown off. And next day to repeat the same, and before doing that, 10 more sections. So every
Right.
day the potency will be raised. This is
Right.
how I do practice, and it is working very well last 20 years.
So
When
for
told
which
that
patient
he
you are
never
using it?
never use the same potency.
Never use the same potency. Every day,
Yeah,
10 sections, downstrokes will be
yeah,
there. Every time it will be increased the potency.
yeah.
Okay,
Which
and
is
in which
important.
We
cases
are
you are
no, no,
using?
yeah, we are not.
I
Sorry,
think
just a
that
minute. Uh, uh, Potency or magnitude is a different thing. By the when they use the adding the water or like a succussion, it is just gradually we give the some frequency changes, not the potency. Because for the making the potency, we need the proper ratio. Suppose you want to 0/2. When you adding the water, that time we not say that this is a 0/2. Potency is never. LM1 is the same, but the just little bit increase the magnitude. I forgot the word, but there is a potency is not changed. Potency matlab 0/2 next potency. You have, if you want to make a 0/2, so then you have to turn the one part of the 0/1, then again use the 400 drops of the alcohol, 100 drops of the water, then mix, then succussion, that is a 0/2.
Mm.
50 millismol scale is a little bit different.
You use one scale for how many days, sir?
I use only 1 month,
One scale.
one scale, 0 bar 1, 1 month, one
One
month or
dose
two,
every day. Every day one dose.
every day 1 dose with 10
Okay.
sections, 10 sections,
Okay. And which cases? Every cases?
every case, even in acute cases also.
Okay.
but the acute cases don't need a whole month worth of medicine.
Yes.
Not required, not required, only few days. Few
Mhm.
days
If
after,
that,
patient will come back and he will say, I am all right. So
right.
sometimes,
That's
no,
true.
I may,
When
sometimes
Or
prescribing
patient might not come.
Yeah, if they
I will,
don't.
I will miss my monthly consultations too.
No. When patients start feeling okay, they will just forget doctor.
Yeah, but
That's
you know
and
what
if
true.
I
the
do?
medicine
I
is wrong,
message them and I say, hey, how are you doing? And that works. It does. And then that way they feel like they're getting really good care.
is it true that we need to be very, very clear when selecting 50 millisimal scale, or if it is not right, it won't work?
In short, I will tell you. In short, I will explain you. Huh? See, every time I tell the same story. If you have a drug is crude. Imagine, drug is crude, and that drug will have direct effect on body, right? That drug or that say poison will have a direct effect on body. Say like 100 grams are sufficient, or 100 gram is a fatal dose. 100 gram is fatal dose for human body, right? If you give 100 gram, the person will die. Okay. Now what you are doing? Don't give a person 100 gram, but give 5 grams. A crude, 5 gram crude. He will not die. Definitely, because 5 grams is not a fatal dose, but still he will start developing a symptoms. Right? Every day feed him 5 grams. Probably after some days, see, 100 grams will complete in 20 days. But after 20 days and after consuming 100 grams, he might not die, but he might be a very, very severely ill. Right? What this teaches you, when you are giving a small amount of that drug, body is also responding to that medicine or that poison. It's also start reacting against that poison also. So immunity is building up from inside. Simultaneously, you are hammering with the new dose every day. After 20 days, you are completing giving a fatal dose, but patient is still alive. He is not dying, though he might be severely ill. When you are using potencies, just imagine, we are using a minute dose. Minute dose means that dose is not sufficient to have direct pathological effect, or say that dose is not sufficient to boost the primary action of the drug. You know what is primary action and what is secondary action. Primary action is that, like we see in allopathy, you give a drug and immediately that drug will start forcing body to have an effect. समझते है गुंजन?
हो sir. Yes, sir.
Huh?
Yes, sir.
So now what Hahnemann taught us, we don't want medicine to act like it acting in the allopathy, because allopathy they are having primary effects of the drug, but Hahnemann wants us to bring cure with the secondary action. So drug need to have sufficient quantity to create secondary action, but not sufficient to produce an primary action. Means drug should be so minute, so small quantity, right? So when he is mixing 1 gram into 99 part of a vehicle in centesimal scale, that was sufficient. Means actually he found 3 3C, na?
Yeah,
3C
start with 3C.
to
Trituration of 3C.
trituration of 3C
Mhm.
was that
And 1 to
level of
99
drug.
in a succussion vial.
That 3C was sufficient. 3 to 6, sorry, 6 was that potency from where secondary action was directly starting. Means before that, means from 1C to 6C, drug was creating a primary action. When drug create a primary action, that means you are having aggravation directly as soon as you give the drug. Means that drug will produce action directly on the material body, a primary action, without any interference of body's immune system or defense mechanism. But after that, what will happen? You won't see that primary action, or primary action will be very less, very minute. But that drug is sufficient to push the secondary action, means sufficient to trigger the vital force to produce a secondary action. And secondary action is always equal and opposite the primary action. Right, sir?
If I am not wrong, all the drug provings are primary actions of the drugs only, no?
Right, you are right, you are right. Because if you learn in drug proving, one minute, let me complete. In drug proving, you are using a potency, not higher potency, that is lower potency, and in multiple repetition of doses. Every day one dose, every day one dose. If you are, imagine if you are using a 12C potency or 12X potency, and every day you are taking that medicine, that means definitely with the first dose or second dose or third dose, you will start having that drug symptom. Right?
True, that's true, that's true.
This is a primary action, sir. This is not secondary action. Secondary action will come after that. But if you are using a small dose and then you are not repeating in centesimal scale, what will happen? And if you are using a little bit higher potency, like 30 or like 12C, there you might not see a strong primary action. But you would see secondary action directly.
Will you please explain in a practical way? I'm not understanding. See, if one patient will come, in which cases it
Primary
is
action म्हणजे काय माहितीये का? औषध
No,
दिलं
आता
आणि
समजा आपण
one
if
minute,
we are
I will
okay,
try to
sorry.
explain in Marathi to her. Probably in English it could be a little bit difficult.
No. I'm understanding what you are saying. I'm just not getting the practical approach. See, if I'm getting one patient, in which cases it is the LM potencies are indicated, and see if you are wrong, if you have prescribed LM potency, so how you will recognize कि yes, I'm wrong in prescribing this medicine, and what are the reactions you can expect?
First thing, in LM potency, it is very difficult to have a primary action. So there you might not get a very strong action of drug with single dose or 2 or 3 doses. To have action, you need to, which action? Whatever action you are having, that is not a primary action, but that is the secondary action. And that action might come at first dose if the patient is very, very sensitive. Right? But usually Indian patients are not very sensitive. So you need multiple repetitions. Because why we need to repeat? Because LM is very high dilution. That's why we need to add another dose, then add another dose to bring a sufficient amount of action. Right, sir? Lakshmikant,
Now
sir.
coming to the, I understood, I agree. But Gunjan madam's case asking is different. How you know that you have given a wrong drug in LM potency, when to stop, when to change other remedy. Am I right, madam?
Yeah.
Yes, and one more question. In which cases it is indicated to give the LM potency?
In which cases means?
Pathology. I'm asking about chronic, like in the indications you can like In chronic, what I have understood in chronic cases, maybe you need LM potencies. That is the thing. In acute, someone is using. I just want to learn how you are using.
No, we have a lot of people.
Yes, yes.
They are
The
using
people
in
are using.
acute, they are
Yes,
using in
yes,
chronic.
yes,
Even
yes,
we have just one who is using in
yes,
pathologies also.
yes, yes, yes. I'm just
Means
knowing.
deep
I,
pathologies
I just
also.
want to understand. Okay.
So that is answerable.
What I understood, let me tell you, madam, what I understood and how I approach your case is, so for example, even in acute case also, even I can explain my own case. Suddenly I
Mm.
developed left flank pain, left flank severely pain. That I thought why it is only left flank is coming pain. So am I having any strain or something? I started applying some balm and everything, but I do not understand. It is then maybe it could be a renal stone. I understood and immediately I took a scan. And yes, it is a 7 to 8 millimeter stone. It is there on the left kidney, and all the symptoms I wrote down. And it was Naxwamika has been selected and started giving the Naxwamika. And severely, instead of getting relief, the pain has been aggravated to the core. I couldn't stand, I couldn't sit, I could literally roll on the floor. That much of severe pain. Then I called my son and I asked him, I can't tolerate this pain. Go and get some painkiller of allopathic tablet. He went on to bring a tablet, but in the same time, I started repeating the doses every 10 minutes once. One spoon of 0 bar 2, Naxwamika. Then I realized that from my back, the pain is coming down, and suddenly the pain is into the pelvis area, pubic area, and I feel that something is entering into the urethra, and the stone has come out. It's a span of almost only 25 to 40 minutes time. Here, what I want to tell, even acute cases also we can give LM potencies. There is no specific rule and regulation to give LM potencies either in acute or in the long. Any cases we can give. That's my experience. First thing. Are you with me, madam?
Yes, yes, I
And
understood.
and in acute cases, as Tikwa madam told, immediate response if your drug is correct, within few doses you will get relieved of that acute case. Acute cases results will come very fast with LM potencies.
Okay.
I
Second thing,
agree. I agree. I'm
uh,
back.
second second thing in chronic, any chronic case, if you are confident about your drug selection, yes, you can start with 0 bar 1 millismol potencies. There is no hindrance or no inhibitions. In some cases only LM potency should be given. No, I don't think so. Any case you can give. If your drug is wrong, if your drug is wrong, the patient do not develop any relief of the symptoms. He will
Okay.
not be
On
having any. He will not be having any relief. Moreover, if you keep on repeating the drug, patient will develop
New
the
symptoms.
symptoms of the given drug. Symptoms
Right,
of the given drug.
right.
Symptoms of the given drug.
in how
That
many
is that.
days generally you can see in chronic case I'm saying?
Again,
Depends.
it
Because
depends
in
upon the
acute, you
patient.
cannot wait for 7 days or 8 days.
No, no, I'm
Yeah,
not
yeah, yeah.
asking about acute, sir. I'm asking
Uh,
about chronic
I have
cases.
seen patients in
Everybody
15 to
responds differently. It's hard to say.
But in 10 days you can see the response.
in some patients.
Sometimes you'll see like a slight
third
return of
day,
symptoms
If
3 to 4
in
days.
just a
if your
couple of days.
medicine is right, then the result starts in minutes,
Immediate, immediate.
immediately.
Okay.
Before
Yes.
when I left this our meeting, I just went to see one of my friend's mother. I just gave her arsenic album 30 after dissolving in water 1 teaspoonful, and I said just give every 5 minutes if the vomiting is there. After 1 teaspoon, no vomiting. Otherwise, she was vomiting for last 7 8 hours. every 10, every 5 minutes, every time nausea and nausea and nausea. As Dr. Lakshmi was sharing his renal colic case of stone,
Mm.
long
Mm.
back, I also had right-sided renal colic.
Mm.
And that day I went to Delhi and I was having mild pain when I started from my place. When I reached to my friend's house, I said, yeah, I am having this right renal colic. Only what happened? When I was going from here to Delhi, my father said something and I was annoyed on that. I was rather angry. I didn't say anything, but I was rather angry and I went to Delhi. He was asking me not to go. This I am saying about 30 years before. So my friend said, take Colosins. I said, okay. We supposed to see some patient. So I said, okay. He prepared Colosin 01 in 30 ml water. I took few drops and then we started. By the time we crossed 5 or 10 kilometers, pain disappeared. Just single dose. So in acute case, I agree with Dr. Lakshmi. If the medicine is right, it gives results like this.
One more
It,
question.
my wife is a allopathy doctor, right? She takes the medicine and she, before crossing the clinic gate, she comes back if the medicine is wrong. She says medicine is not right. I don't have any relief. For her, relief should come within seconds.
Okay,
In
if you are wrong with the LM potency, in
mm,
chronic cases, I am asking.
mm,
Either the patient will get relief, or if you repeat the doses in 10 days, you can see
no,
the
in
10 to
chronic
15.
cases, generally, I don't wait up to 7 days. I ask the
Mhm.
patient, report me within 2 days.
Okay,
How is the result? Then, if there is no result, I ask him to repeat the more frequently, just
okay,
twice a day to thrice a day to 4 times a day, or maybe 4 hourly, 6 times a day. If the
Yeah,
medicine is correct,
I don't
result.
wait. I just go like, I'll even have people check in like at nighttime after their first dose, or maybe the
Mm,
next day. I don't wait
mm.
either.
so you have to repeat it more frequently if the patient
I
is
generally do that. I generally do that.
okay. And then we need to once if the patient has started reacting, then you need to like you
No,
said you
we increase the gap. We increase
you
the gap.
increase
Maybe
the
12 hours, 24 hours, 36 hours, 48 hours, till the improvement continues, no repetition, even in 50 millisecond.
yeah,
I
yes,
follow that.
you told me what you told me. I just repeat. In 50 millisecond scale, in chronic cases, you just ask the patient to come after 2 days and repeat, tell the progress. And if
Report. I don't
uh,
ask him to come. I just ask him to report.
report, if
Mm.
there is some change, you just repeat the medicine more frequently, like two
If
times,
there is
three
no
times.
change, if there
If
is
there
no
is no
change,
change. Okay.
no change. If
And
there
if
is change,
there,
then there is nothing.
okay. And if there is
In
no change,
millisimal, then we
mm,
repeat frequently.
mm,
As Hahnemann has said in Organon somewhere, in
mm.
millisimal, the aggravation comes at the end when
Yes,
medicine is
Yeah.
yes, yes,
overdosing.
yes.
But I follow the previous centesimal principle also. Till their improvement continues, don't repeat.
Okay.
Even while repeating also, I do not find any adversity.
Yeah.
Okay.
I
If
have seen that also.
if
Mhm.
any new symptom you just see, then you have
Mm.
to stop the medicine. Is it right?
Any new symptom, if it is related with the same medicine, then we need to
Ah,
stop the medicine. If it
Okay.
exactly.
is not related with the medicine, then we may consider the new medicine.
And when you, what reference
And
you
we
see
may
for the medicine?
one more minute, 1 minute. If it is a symptom, a new symptom, we need to ask the patient whether it could be
Yes.
his old symptom.
Okay.
Yes.
If it is
Yeah,
old
that I
symptom,
think.
again we are right. We are right. If
Yes.
it
Yeah.
is not old symptom, if it is not related to the medicine, we
Then the
need to
disease is
find, we need to
Yes.
disease.
we need to select the new medicine.
Yeah.
No, maybe the disease is progressing. It is a disease progress. Maybe it is the reason. Is it right?
That's why you need a new medicine.
Okay. But if you have to continue, actually, I'm not using it. So to come in practicality and use, once I will start using, I will be more confident. I think so. For
Correct,
50
correct.
minutes,
Please
you
start
might
using
scale.
them. Please start
No, but
using
I'm
them,
just
and you.
scared. I'm just scared if I give the medicine in repetition, it should not harm any patient. That's the thing.
Madam,
No, you will
one
not
thing.
have any aggravation in LM potency.
Okay, fine.
It will be
Because
always in the end.
it will be at
We
the
are
end.
even though you repeat, even though we are not harming the patient like allopathy.
Yeah, but
Yeah.
there is some like fright. You can tell it fear. I'm scared of it.
Uh,
I should not
Yeah,
harm
you can
anyone.
tell people during treatment after they start feeling better, you can just let them know that when they're nearing the end of that medicine being useful, that they're going to have some increase of symptoms and to call you. And you just reassure them before it happens, and then they know, and then they're not scared that it happened.
Right.
And if you
That's
say
right.
that one, the patient never use medicine.
Yes, madam. In India,
They
Really?
never use medicine, and they will come back also. We lose the patient, we lose the consultation.
No, no, it depends on the intelligent patients.
yes,
Very
yes,
few,
yes.
very
Very
few
Yeah.
few,
patients.
very few,
I
very
never
few.
tell the patient, you may get aggravation, nothing. I'll give them and I will ask them to report what is your experience, what is your
Mm.
understanding, and what is your what to say,
Yes, I had
opposite.
one experience with
No,
like this. I
development,
had given some
whatever may be the
medicine.
development,
Development,
they should report.
development. And out of
That is
10 patients, maybe one patient may come out and tell doctor, I am getting aggravation of the symptoms. He will not use the word aggravation, but he will say all my symptoms are still
Worsen.
persisting
increased,
or more
worst.
increased,
Mm.
more. Then I will explain them to an understandable patient. I will open the Kent 12 observation. I will show
Mm.
them this is the third observation.
But still,
So
they
we
don't
are
understand, sir. They say, "Ki, yeah, what you have done, it has increased. I don't know. I will stop this treatment." It is like this only.
No, no, Gunjan. There is one more
Mm.
thing. Some patients are very sensitive.
correct.
Yes,
We are
yes,
using idiosyncratic.
yes,
In one of my case,
mhm,
the patient was having allergic to almost everything,
yes.
allergic to even homeopathic medicine.
Mm.
Even if he smells, his body reacts. His body
Yes.
becomes red. Upper half of the body becomes red, like tomato red. He took almost all sorts of medication, allopathic, homeopathic, Ayurvedic, and all other this natural medicine, home medicine. I still remember I gave him Aconite 01.
Okay.
He was allergic to so many things, but my prescription was Aconite 01. And he said, Sir, my problem aggravated after first dose. I
Mm.
diluted it more. First cup dilution, second cup dilution, third cup dilution, up to seventh cup dilution, he was not showing any aggravation and he recovered of his problems. So even in this millisimal, at times we need to dilute. He was joking with me, sir, you are giving me water only.
Yes, it
I
Mm.
happens.
said, I said, this is the water of magic. You just continue. It
And
is our
sir, one
medicines are
more.
water of magic only.
I um, I have to go. I'm sorry.
It's okay.
Huh?
It's
Okay, sir.
late.
Okay.
Mhm.
Yes, actually, it's late.
It's
We
late
will have
and
presentation again.
actually I am still in the clinic.
Yes,
Mhm.
yes, yes,
Oh,
yes.
You can
oh.
see.
Mhm.
Thank you so much,
Yeah.
sir.
And you have
Thank
a
you so
fancy
much.
clinic as opposed to mine, which is not
Mm,
fancy.
mm,
I have a window and some walls.
mm, mm, mm.
And just one, sir.
Yes, sir.
And
Okay, I
you
will
told me,
leave guys. You
Okay,
sir,
okay.
continue.
good.
Thank
Okay,
you, sir.
Sanjay. Good night. Bye
Thank you.
bye.
Thank you, sir. Sanjay, sir. It's happy.
He's gone.
Just one, sir.
Yes, Lakshmi, Dr. Lakshmi.
You, in your experience and your wife's experience,
Mm.
I, and immediately you are getting the relief. In my kidney
Mm.
stone case, Naxwamika has
In your
brought out the stone.
no, in your Naxwamika case, actually the stone was descending
Yes.
and it was piercing the ureter and urethra. That's why the
Ah.
pain was there. It was
And
not that the
I
medicine.
say,
It was
no, no, no,
not the
no.
medicine which is not giving relief. Since the
Yeah,
stone was
okay.
descending down, though the pain,
I
that's why the
understand.
pain.
I
Mm.
I agree. I agree. And my addition is Naxwamika expelled it out.
Yes.
Yes, yes,
Yeah.
that's right.
Sir.
In many of the ureteric stone cases, where
Hmm,
stone impacts at the ureter vesicle junction,
ah,
Naxomica is the one of the choice of the medicine. Just you give a higher
hmm,
dose, 200
hmm,
1 10 m. It just
hmm,
expels in few seconds. I have many experiences with that. Just one dose
hmm.
of 200 or 1 m, the more the irritable the patient is, higher the
Yes,
potency.
yes. The same thing happened to me.
Yes.
Hmm, hmm,
If you would have taken Naxomica 200 or 1 m or 10 m, it would have
hmm.
passed in few moments. Yeah, less than five
Possibly.
minutes. Hmm.
Okay, the
Hmm.
more the pain, more the potency. The energy
No,
level
more
of the
the pain.
patient is
No, not only
Not the
that,
more the
more the
pain,
pain, more the irritability,
more the
okay.
irritability.
more the irritability, and higher the potency.
Correct.
Okay.
And if the pain is causing him more to weep, drug will be
Mhm.
Palsatilla.
Yeah,
Yes.
Madam Gunjan, madam, did you understand?
Yes. 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 Yeah, I am
The
understanding.
irritability making the drug of Naxwamika, weeping or anything, that thing
Yeah,
change the choice
I
is
understood. Even I have the experience, like I have given in one kidney stone patient and it expelled out like that. But it
and the
was
more the
not in an
pain,
acute case. It is not in an acute. It was in a chronic.
more the pain,
Yeah.
more crying, more terrified, and even the scratching the attendant. The medicine is stramonium then.
Yes. Yes. Catching is the stramonium. Yes.
Pain, crying, and terrifying,
Mm.
scratching or clinging, then
Yes.
stramonium.
Yes.
Homeopathy is something very magical. Always, whenever I see and get the relief, I say, yeah, what is this? This is something miraculous. This is something
yes,
miraculous.
And
yes, yes, yes.
if we give LM in acute conditions, if it is not working, it will not show any change, any relief, right?
Yeah, yeah, true. If the medicine is not right, you will not have any change.
Of course, it is with any cases.
In some cases, what happened? They show some partial changes. Maybe the
Mm,
medicine is partial. It may happen. For some time, there is a relief, and then again the complaint starts.
yeah,
So need to change the medicine, right?
Now,
right.
sometimes if it's relief and then the complaint comes back a little bit, just needs to redose.
Yeah.
Yes,
Okay.
yes, yes, yes.
Okay.
Sir,
Yeah, this has helped me a lot, ma'am. I just redose and my patient get cured. In so many cases nowadays it's happening. I just redose and it works.
Good.
Just that,
Yes.
yeah, I don't use more higher potencies because I'm not confident much. So I don't use 1 ml like this. Oh, maybe as time
You
pass,
you t-
I will
you
learn.
take some medicine which is having lack of confidence.
Yes.
There are 100
you
plus
can cut
medicines in lack of
you can
confidence.
cut a paper, you can cut a paper
I
with a
just take
blade,
sensitive.
madam.
Huh?
Madam, let me tell you, let me complete.
Yes.
You can cut a paper with a blade, but you can't cut a tree with a blade. You need
Yes.
higher potencies. Yeah,
Yes.
every case you can't be cured with a blade with limited
Yeah, I just keep on
potencies.
repeating that thing. See, when I'm giving 30, I just repeat it, repeat it, repeat it. I just don't do that.
No, no.
You have to do.
No. All
I
the, we
am
have
a
so
model
many,
doctor.
so we have weapons in our hand.
Yes.
Lots of weapons. We need to use them. We need to learn them how to utilize
How to use
properly,
them.
where to utilize which potency.
That's
Exactly,
right.
sir.
That's right. You have
Uh,
all the weapons in your, that is weapon armor. You
Armamentary
need
yes.
to
armor.
know
But
Uh,
armamentarium.
to learn
You
that
need to know
we use
when,
the
where, which one, and
okay.
yes,
in which intensity you need to use.
Okay.
yes.
Okay.
Yeah, we have a problem where we live is that it's so hard for people to access medicines. So I can't just say, I have like, let's say I see somebody in a different city and there's so few pharmacies and it could take so many hours or maybe a day or more for them to be able to actually pick up their medicine. And so I don't have that flexibility of, well, let's move higher. Let's move lower. It's just kind of like I have to just kind of like make my best judgment, and then we have what we have, and then we have to deal with what we have
Mm.
because it's
Yeah.
just so difficult to get medicine. It's not available everywhere.
In such situations, it is what you are saying, that is absolutely right. We need to be very careful and confident in selecting the medicine. Once we have
Absolutely.
selected,
Uh-huh.
because at your place, getting the medicine is quite difficult.
Mm-hmm. Yes.
Maybe pharmacies are far away.
Pharmacies are far, the medicine is not inexpensive, and it's just complicated. So if I make a mistake, that can be a really big problem. So I have to
Yeah.
be very,
So
very careful.
you cannot afford any mistake.
No, not really. No,
And
no, I
one more
can't.
point I want, one interesting point I would like to add up here. When I read Dr. Kanjila's book,
Yeah.
he was jailed in independence era, and he is having limited medicines and limited doses and limited potencies. Wherever we go, usually homeopaths will start giving treatment and start giving the drugs. And when he has given some patients some medicines, and he would, after some time, after seeing the patient's results, he would like to either extend the potency or want to change the medicine actually. But as Tikva madam facing the problem, he's in the jail, and British people are not allowed him to practice and not allowing him to get the new medicine or any other potencies as he wanted. So months and days together he want to wait. In the meanwhile, patient was left without any medicine, and in many cases he saw that the patient was doesn't require any medicine. He cured.
Even
He got
even
cured.
what I have practiced, see, I have practiced around 2010. I have started doing
Let
practice.
me finish. Let me finish.
Okay, okay,
Let
okay.
me finish.
Sorry, sorry, sir.
So that the conclusion what he said is, sometimes either repeating the dose or increasing the potency or changing the medicine could be the impatience of the doctor because of his understanding, maybe a hastiness of the doctor, not allowing the patient to experience the benefits of the therapeutic benefits of the given drug or potency, he says. He concludes that. Again, he says, do wait for some more time. Even if you want to change the medicine, even if you want to change the potency, give the patient some more time, then you decide whether to change or not. This is a very good point. I have studied through his book. Sometimes I feel the same because of my hastiness. I may be repeating the dose. I may be going for the higher dose and all. What is your comment, madam and sir? Madam Tikma.
You are right, Dr. Lakshmi. This is right. It is all depends on the sensitivity.
True.
It is all depends on sensitivity and नहीं बोलो अच्छा आते हैं 3 मिनट में आते हैं it all depends on sensitivity. More the sensitive patients, they require less the time. If the patient is less sensitive, or say a laborer patient, in those cases, in those patients, you may take the time. You may need to wait. Or if the pathology is very gross, in those cases also we need to wait. So it takes time to have effects.
Yes.
Here, when, as you said, Dr. J.N. Kanjilal was unable to get the medicine or so, in some of my patients, those who are in other parts of the country or in some other countries, they don't have medicine. There, I suggest something different, and that may we may have some different thing in our mind. I just ask them to write the name of the medicine on a piece of paper,
Yeah.
put in the
Yes.
glass, stir it,
Yes.
and drink it. Or I ask the patient to repeat the name of the medicine as chanting. If the medicine is right, they get the relief.
One of my sir used to they take the hairs of the patient and they put in the bottle and store it. Whenever there
Yeah.
is acute,
Uh,
they just dip that hair in that and the
do we
patient
know
gets it.
how that works? Do we know that the
Yeah,
mechanism of working?
because there are the DNAs and RNAs in the hairs
No, no,
also,
no,
no?
no,
So,
no, no, no. And probably in next meeting, I will let you know the mechanism of action of those medicines. There is one
oh,
doctor in UP. He
yes,
practices maximum that,
yes,
and
that
I
doctor.
asked him once how these they get relief. He said, I don't know. I said, I'll share the link, how it acts. So there is a mechanism of quantum physics. So we need to understand those experiments first, conducted by NASA and other agencies. They reached
Yes.
to some other level, but I took those experiments in homeopathy to make them understand how it works.
You know
And
about the
it will
Definitely.
work. It will
But-
work. But there are going to be a certain segment of patient that are not going to like that because it's just going to be so weird for them. But it actually, I have tried it and it does work. It does.
Yes, it works. It works. Even I have tried it. It works.
Yeah.
They will be named as name. They will be
Yeah.
named as a something.
I mean, in
weird name they
reality,
will put.
Yeah, it
everything
is
is
witchcraft kind of
interconnected.
thing.
Everything's interconnected in the whole world.
Yeah.
So,
You
we
are right.
just
It
reach
is.
into that interconnection
It is.
of everything.
Yes, Dr. Tikwa, I 100% agree with you. Everything is interconnected in the whole world,
Yeah.
not only with the humans, even with all other species, all
Oh,
other
for sure.
species. And if there is, this is my feeling, if there is life in the other part of the universe, that is also interconnected. Nothing is separated.
That's true.
Nothing. Quantum physics has proved this, that we all are interconnected. I have to go because
Yeah, sir.
this
We all
time
have
is
to go. It's late.
this time is Krishna's birth time. So my wife is asking come and say welcome.
Okay.
Right,
So I
sir.
need to
Right,
leave
right,
that.
right.
Thank you,
Okay.
everybody, for coming.
Thank you, ma'am.
Thank
Yes,
you.
Thank
madam.
Thank
you,
you.
Thank
sir.
you very much.
Thank you. Thank you.
A good discussion indeed.
Uh-huh.
Yeah. Bye bye and good night.
Good
And
night.
my greetings and this happy moment for this Krishna's first time.
Thank you very much.
And thank you. Thank you. Good night.
Good night.
Good night.